Hello everyone. So let's start with the topic of surgically important spaces of the hand. So in the normal condition there is no space of the hand, but when these spaces get infected, in case of any kind of infection is formed in these spaces, pus fluid accumulate here, then this spaces becomes evident. So surgically important spaces of the hand is mid-palmar spaces, thenar spaces, lumbrical canals and spaces, pulp space of the digits. Let's talk about the other important spaces of paronar, dorsal, subcutaneous, aponeurotic and that of subcutaneous spaces, digital synovial sheath and that of radial and ulnar bursa. So I would like to show you many diagrams so that you can understand where these spaces are located. So firstly, I would like to show you this image. In this image, when you see the surface projection of the space, so this is my hand, palm of the hand. And onto the lateral side, if you go towards the lateral side, in the lateral region close to the thenar region, we have got here thenar space. On the medial side, in this region, we have got the mid-palmar space. So I will show you a cut cross section to understand the boundaries of the spaces. Before that, if you will see this image, this is the surface projection, same as the image which has been shown in this diagram. So here that means skin and the fascia and the aponeurosis here, this is all forming the anterior wall. So dorsally, this part where the metacarpal bones are there, which is forming the dorsal wall, and in between there is intermuscular septas. Distally, it will be continuing with the lumbrical canals, which is going towards the fingers, and proximally it will be more closer to forearm. So with keeping these in mind, we can understand the walls and the boundaries of mid-palmar space and thenar space. So this image is the surface projection for the location of the space. Let me show you this cross-sectional area. Okay, so when you can see this cross-sectional image of the hand, you can very nicely appreciate. In this diagram, you can correctly appreciate the thenar and that of the mid-palmar space. Okay, very nicely you can appreciate the thenar and that of the mid-palmar space. So let me just enlarge this diagram for this. So yes, everyone, can you see this diagram? So yes, when I am showing you this diagram, you can correctly appreciate I have written the word TS and MPS. What is TS? TS means thenar space and MPS means mid-palmar space. So exactly this is how the palm is cut transversely, and here in this space when it is cut transversely, you can appreciate this will be the anterior relation of the structures. These all metacarpal bones are the posterior relation. Here we will have the intermuscular septas. So here we will have the lateral intermediate and that of medial intermuscular septa as well, that lines, that vertical lines which I have drawn. So let me on another color. So can you see here, these are the intermuscular septas which is separating this, and let's describe the boundaries of the mid-palmar space and thenar space. Okay, so for that I would like to enlarge this image, and when I am enlarging this image, you can understand the boundaries of mid-palmar and thenar spaces. Okay. So this is a schematic diagram to make you understand the mid-palmar space and thenar spaces boundaries. So when I enlarge this, you can clearly see the spaces. Okay. So here you can see this is the mid-palmar space. This space is the mid-palmar space which is located on the medial side. So this is the mid-palmar space on the medial aspect of the palm, as you can see in the diagram. And if I talk about its boundaries, so it is having on anterior aspect, it is having palmar aponeurosis. On anterior aspect, it will have the palmar aponeurosis, it will have the digital nerves and vessels, superficial palmar arch in the medial aspect. On the dorsal aspect or the posterior wall, it will have the metacarpal bones. So metacarpal bones and the interossei muscle attached to it. Onto the medial aspect, it will have medial intermuscular septa. Onto the lateral aspect, it will have intermediate palmar septum. Now, if I talk about the thenar space, so see here, this is the thenar space, and if I talk about the thenar space, you can see here, now I am talking about the thenar space. Thenar space will have the tendons of FDP and FDS. So actually the tendons, so what you can see in this diagram, let me use this color. So you can see all these structures which I am showing you with this rounded tendons, these are the tendons of FDP and FDS. So here for the middle ring and little finger, the tendons of FDS and FDP is related to the mid-palmar space. When I am talking about the index finger and for that of the tendon of the thumb, it is related to the lateral side, that is thenar space. On to the dorsal aspect. When you see the dorsal aspect, what you can appreciate that the adductor pollicis muscle is related onto the posterior aspect. Okay, adductor pollicis muscle is related onto the posterior aspect in relation to thenar space. Okay, so basically you have to know the idea of the surface projection. You have to know that the relations will be well appreciated once you transverse section your palm. So let me write about the boundaries of each space. So I would like to write the boundaries of each space so that you can appreciate the boundaries, and then we can also know about the contents and its continuity. Okay, so firstly I would like to write about, so please write down mid-palmar space. So firstly I would like to write about mid-palmar space. So when I talk about mid-palmar space, the mid-palmar space is related, the mid-palmar space is related anteriorly. Mid-palmar space is related anteriorly by palmar aponeurosis. So it is having the relation of palmar aponeurosis. Also digital nerves and vessels, digital nerves and vessels of the medial 3.5 of the fingers and the digits. Also it is related anteriorly with the superficial palmar arch, superficial palmar arch. Other than that, anteriorly the mid-palmar space is related to the flexor tendons for the fingers, that is medial 3 fingers, medial 3 fingers. That means the fingers, that is the ring finger, the little finger and the middle finger of the tendons of FDS and that of FDP. Okay, FDS and that of FDP. So this is the relation of mid-palmar space onto the anterior aspect. Now let's talk about the relations of mid-palmar space onto the posterior aspect. Okay. So this is anterior wall or anterior relation. When I am talking about the mid-palmar space, please write down the posterior relation. So when I am talking about the posterior relation, you can very nicely appreciate posteriorly it is related with the metacarpal bones, that is the medial metacarpal bones and the related interossei muscles, that is dorsal and palmar interossei muscle. Laterally it is bounded by intermuscular septum, intermediate septum, palmar septum, intermediate palmar septum, and medially it is bounded by medial palmar septum. Proximally it is continuing with the forearm space of Parona, and dorsally it is continuing with the lumbrical canals. Actually it is important, lumbrical canal. So actually it is important to know that we already know that the lumbrical space or canals are lumbrical muscles arises from the tendon of FDP, and we know that mid-palmar space is onto the medial side. That means it will be related with the second, third and fourth lumbrical canals. I would like to show you the image for that. So before that, I would once again like to show you this image. In this image, you can again appreciate here that you can clearly appreciate that mid-palmar space is lying on the medial side, but the thenar space is lying on the lateral side. So thenar space will be anteriorly related to FDS. See here in the diagram, it is related with the tendon of FDS and FDP, which is for the tendon of index finger, and also with the tendon of FPL for the thumb. On to the posterior aspect, it is related with which muscle? It is related with adductor pollicis muscle. So it will have the continuity. So that means thenar space will be related to the first lumbrical canals, second, third and fourth lumbrical canals will be communicating dorsally with mid-palmar space. One more important point is that thenar space is proximally closed. So that means there is no communication of infection spreading from thenar space into the forearm. So that is a positive point. So I think this image is making you understand the boundaries of the mid-palmar space and thenar space. I would also like to show you an image for lumbrical canal. See here. So in this diagram, you can see the continuity of mid-palmar space. You can clearly appreciate the continuity of mid-palmar space with that of the lumbrical canal. That is the space which is surrounding the second, third and fourth lumbrical muscle. So this is so we have got second, third and fourth